Thank you, ladies and gentlemen, for your time. My name is Will Shipley. I'm here on behalf of a medical software company in the Los Angeles area. We have been working on providing clinical software for laboratories for more than 20 years. And we've seen the industry change and evolve over time as we've been operating in it. When we were first interacting with sites, many of the small physicians' laboratories that we were going into in the reference labs were entirely separate, kept their laboratory systems entirely separate from the internet, had no particular need to talk to any other systems, were simply there for the process of interfacing with the instruments and printing paper reports to get sent back to the doctors. Well, with the improvement of technology and the rise of the internet and various mandates to improve interconnectivity and interoperability, laboratory systems end up having a much wider impact in our field today. So, moving out from the core laboratory process of taking in orders, sending them out to the instruments, getting your results back, getting the reports printed out, you can channel your improvements into a number of places. First, you're probably interested in improving your reliability of results via procedures such as Six Sigma or other more informal procedures, reducing your turnaround time and getting results to the doctors in a more speedy fashion, and you're interested in providing better quality of care for patients, improving the patient's outcomes in whatever way is appropriate. And with the rise of trends in the industry, there are ways to accomplish these goals. For instance, new communication opportunities such as email, text notifications, internet portals, web-based tools, all provide an opportunity to connect more closely with your doctors. Similarly, these tools allow you to get information more quickly from the practices and communicate changes in status more effectively. Furthermore, various sites are no longer isolated to each other, isolated into individual silos. Interoperability is becoming a far more prevalent option in the industry. And I think that is an arrangement to be encouraged, given the support that provides for patients and their clinicians. Finally, inside the laboratory, the ability to consolidate all of your departments into a single system allows you to supply the tool set from your laboratory system across all of the departments, and allows you to more effectively enter a world of more interoperating systems. So, walking through some of the communication tools that we have available. As previously mentioned, the rise of internet portals would allow one of your doctors to log on to log onto a web portal and trace patient results in real time as soon as they're made available from the lab. As soon as they've been released by your supervisors, the doctors can access them. Or you can take it a step farther and have your doctors and clinicians inputting orders via a CPOE and allowing those orders to be transmitted electronically, such that by the time that the samples arrive in the lab is already expecting the order. This reduces transcription error on the part of the clinician staff. You're no longer transcribing the doctor's orders onto paper and then transcribing them by hand into the system. There are fewer opportunities for the train to get off the tracks. And furthermore, it will improve turnaround time. Now, internet portals aren't necessarily just for doctors. There is growing regulation in the United States that requires reference labs to be able to provide to the patients whose blood has been processed there an electronic export of their data. And so a web-based patient portal for patients to log in and look at their results alongside what their doctors could view would be one way of handling this approach, or one way of handling this, this goal. Now, one caveat about an internet portal or some other mechanism of providing computerized physician order entry is that while it will reduce transcription errors, it does provide a change-up to the way that you're expecting to receive orders. Instead of knowing that orders and add-ons are going to come through conventional channels such as notes, couriers, or phone calls, you're now dealing with the possibility that an external system, such as your internet portal, could provide add-ons or modifications to demographics unprompted. And so it's important to make sure that you have a workflow in place that will account for this change and be able to fold those changes and those modifications into your standard practices. For instance, having a deliberate check-in process to handle your electronic orders and orders from electronic systems would allow you to compare what is in the system already, what your CPOE system has provided for the laboratory, with the samples that came in from the courier, to make sure that there haven't been any misunderstandings. This would take the place of reviewing a paper requisition, and in fact, you may be handling a mix of electronic and paper requisitions at any particular moment. Furthermore, we recommend having a review process where modifications that have come in, especially from electronic systems, to the patient's demographics and to existing orders, are checked by some of your staff members. Now, we have one practice that we've interacted with in Los Angeles that runs all of their paper requisitions through a secondary practice. They have a second set of accessioners who review the requisition form alongside the samples that have been input into their LIS to make sure that there have been no transcription errors at the first phase. While it's not necessarily the case that you need to do this to all of your requisitions, it's possible that you may want to survey a certain percentage of your requisition forms, or at the very least, provide this extra degree of scrutiny to modifications that have been made out of band by your external systems. Furthermore, it's possible for your lab system to take particular problems that have come up that accessioners or lab staff have encountered on a given accession and flag the accession for more information. So if a phone call needs to be made to the doctor's office to explain a certain diagnosis code, or to ask why a particular sample does not match the tests ordered, or to request clarification on what to do in the case of a hemolyzed sample, those accessions can be pulled out of your standard workflow while any problems are handled on them, and then brought back into the flow later. Now, I've been talking about external systems mainly in the process of getting orders from doctors and clinicians more quickly and getting results out to them more quickly. But there are other electronic communication streams that can be very useful for your practice. For instance, if you have an external source of truth for patient demographic information, health history information, or insurance information, being able to connect out to that information will help improve the currency of the data in your system. Now, you could handle this with a medical health card, being able to scan a medical health card that contained the patient's demographics. You could do this. You could perform eligibility checking, for instance, on a downloaded database from particular insurance clearinghouses, or you could have an open communication stream to a national health database and use that to verify the patient's demographics and insurance information. If you're going to be interacting with multiple systems and interacting in a more fluid manner with your clinicians, being able to track multiple identifying numbers for patients will be useful. Even in a system where there is a national health ID that you could theoretically identify all patients with, such as the MyCat ID in Malaysia, there are still going to be some corner cases where patients are not tracked under that ID. People who have not been assigned an ID yet, people who have a foreign passport ID, a military ID, being able to track these different IDs for patients in the system and be able to use whatever has been provided for a given patient will allow your lab to be more flexible. Furthermore, if you have a patient who has been seen by multiple clinicians, being able to track the independent chart numbers that the various offices have used to represent the same patient could be a useful way of consolidating the patient's information into one source of truth. The concern there is that you're going to need to be able to match on more than just the ID. Being able to match on as much of the patient's demographics is worthwhile, because name and date of birth and administrative sex are not enough to make that distinction. Finally, when a critical value arises, being able to alert the doctor for immediate medical intervention is of critical importance. With the addition of electronic channels of communication, your lab system can text out to doctors, text their pages, ring their pagers, or email them with links to your internet portal to get immediate eyes on the critical value. Furthermore, your lab system can have procedures in place that would allow a user to would require a user to document the critical intervention and communicating with the doctor, so that that process has been effectively documented and affirmed in your system. So, with all of these channels of information, the opportunity arises to communicate more fully and more effectively with other practices, be they local hospitals, reference labs that you send out your work to, clinicians' offices. Many different medical practices tend to have a very isolated worldview, and in a growing age of intercommunication, allowing these sites to communicate more effectively with each other means that medical data for a patient goes to where it needs to and is available to clinicians who are making medical decisions for those patients. In a sense, you could treat each of these sites as an individual cell that would be communicating via the extracellular medium with other cells, exchanging information, signaling based on the environments of the cells and based on their function. In that case, information that is necessary for the patient's benefit can be communicated from practice to practice at the with the patient's consent to where it can be most used. And the more connected these organizations are, the more functional this becomes for patients. While at the same time, we have to make sure that the information is secure, such that only authorized personnel are getting access to patients' records. And that tug of war between accessibility of information and security of information are factors to consider when providing interoperability. Now, whether you're interacting with EHR or HIS systems, or you're interacting with epidemiology and public health needs, being able to communicate to external systems means that you can provide more value to the industry at large, and in turn they can provide value to you. Now, some challenges just to bring up while we're talking about interoperability. You're going to need to make sure that the systems use the same, a similar or same patient ID. Usually having a specific ID that they have in common is a strong way to make that connection. You want to avoid mismatch errors. You want to make sure that the systems are actually talking about the same person. Matching on demographics can be tricky, given the amount of patients who share names and dates of birth. You're going to want to make sure that the systems understand the same test codes and that when results are communicated by one system, they are understood by the other. Tools such as LOINC codes and SNOMED codes can make this process operate more smoothly. Finally, being able to communicate both the individual pieces of data, the atomic data elements, so that they can be transformed into whatever form is clinically significant, and a default presentation that is medically useful, such as your standard paper lab report, provides an extra degree of flexibility towards the systems that you're interacting with. So we encourage the growth of hybrid systems that use a combination of HL7, or HL7, typically interacting version 2, and other methods of providing the lab reports, such as HL7 CDA or is PDF files, so that the format of the lab report is unchanged, and the doctor has the ability to access the data in either format. I also want to bring up a couple of institutions that have been growing up in the vein of interoperability that you're going to be seeing more of. One would be a health information exchange, which would be a large commercial or government project that would be dedicated to connecting to as many practices as possible. And they would be basically mandating an orders and results process that would allow everyone to use them as a piece of middleware and communicate through the industry. There have been some high-profile examples of this, such as OLIS in Ottawa or IHIS here in Singapore. You'll also see interface engines such as Mirth appear in laboratories. This is a more do-it-yourself approach, where your IT staff in-house would be handling the process of communicating from your system to the various other systems you're interacting with. Taking one data stream from your system and making sure that it will be given in whatever dialect your external systems are expecting. As we've encountered, much to our chagrin, although HL7 is a widely accepted standard, it is a standard with a lot of flavors of communication. And so having organizations or applications to smooth the process of connecting systems up can be useful. Finally, if your laboratory is communicating as an organism with other organizations, being able to communicate have a single point of communication to the outside world is going to be useful. And being able to, in order to provide that single point of communication, we recommend folding all of your departments and external facilities into a single laboratory information system, such that the single system can collate all the data from your various departments and provide it in a comprehensive report and via comprehensive transmissions. One benefit of this, one benefit of this is that the tools of the LIS become available to all of the departments to use together. For instance, integrated QC. If all of the departments are using your laboratory system, your laboratory system's built-in QC monitoring can be provided for all of the departments. Some other tools in the toolbox include a real-time turnaround time dashboard, which would allow one or more departments to see in real time where the bottlenecks of their process might be, to see where outstanding tests and panels are existing. This will give the laboratory staff a real-time picture of what's happening in their system and will improve efficiency. There's also been reports that having a similar version of this on the EHR or HIS level will allow clinicians to tell at a glance what the status of their ordered items is, which may give them a bit of ease when they're waiting for a particular result to come back from the laboratory. Having an integrated audit trail in your system allows you to track who has been viewing, printing, or modifying accession demographics or order information in the system. Allows you to trace those modifications and determine what the root cause of any particular abnormality might be. This auditing can include usage logs for how often your instruments have been used, how often particular tests have been run, integration with an inventory module would allow you to indicate how much reagent has been used and whether that is expected given your current your test volume load. And having a security log and access requirements for security across your entire system allows your management staff to determine who's been using the system and whether they've been using it in an authorized manner. A similar toolbox item includes the use of scanned documents and requisitions. If you're still operating in a paper form and you haven't embraced internet portals, then being able to scan your paper requisitions or your insurance information and store them electronically rather than in hard copy provides a more flexible footprint in your laboratory. Also, if you're able to digitize send-out or referral reports and attach them to your lab reports, you have that additional information that is clinically appropriate to the patient bound to the original report of your laboratory. Having a rules engine built into your system that all the departments can gain access to allows you to perform automatic reflexes, to automatically comment on results that have passed certain thresholds, to automatically release routine chemistry and hematology results while holding back more complicated cardiac monitors or abnormal results. Being able to encode these decisions into the system at an administrative level allows your laboratory to move in a more streamlined fashion. Finally, being able to pull all of your departments in, you can have for each of your departments sophisticated tool sets. And these tool sets are more often getting integrated into the laboratory system rather than being held out on the side. Examples include paperless microbiology and the ability to rapidly scan throat or urine cultures to be able to review the plates after 24 or 48 hours. Cytology process support, where slides can be assigned to particular cytotechnicians, and the system can automatically track for you the review percentage of the slides that they're performing. Histopathology process support, tracking the process of grossing samples and preparing slides, and again assigning cases to pathologists when appropriate. Toxicology, where a rules engine can come into play to correlate the medications that a patient is currently prescribed with their lab results to indicate whether the results are consistent with compliance with the medication. All of these departments benefit from being part of the standard laboratory system because they get the tool base for free, QC, security, auditing, and at the same time the data gets folded into one place where it can be communicated to the greater medical community as necessary. So in summary, to improve patient outcomes, to improve the goals of the laboratory, to improve turnaround times, to improve the reliability of your testing process, and to communicate more fully with the global community, embracing more and more of the functions of your laboratory system can be a boon to your practice. And in doing so, I would recommend looking into ways to leverage communication paths such as email, text messages, notifications, internet portals, and other web-based devices. Being able to embrace the opportunity to communicate with external systems like hospital systems and EHRs, and to be able to pull all of your laboratory into one umbrella and operate in a consolidated manner. These are the keys to success. I'll be happy to talk about them further if you have any questions.